All right, ladies and gentlemen, if we could ask the chambers to please come to order. Again, if the chambers could please come to order. Again, if the chambers could please come to order. Thank you very much. And we are one member short for the Finance and Government Operations Committee because Supervisor Chavez, the second member of the committee, is doing her level best to be in two places at once, but I think is struggling with that a little bit. We understand she'll be along, we think, in the next 5 or 10 minutes. And so what I'm going to do, looking at County Council, is just proceed as a committee of the whole, understanding that we cannot take any formal action in that capacity, but we will call the meeting to order and we will establish a quorum upon the arrival of the second member of the committee. That does take us to public comment. We do have a couple cards under public comment, so let me ask those folks to please come on up. I have Roger Winslow, Scott Largent, and Francis McVeigh. And, Francis McVeigh is under item 17, so it's just these two for public comment then. Mr. Winslow, thank you so much. Come on up, and then we'll hear from Mr. Largent. Welcome, sir.
Good afternoon, Mr. Supervisor. DSA represents approximately 447 now members that work the streets, the courts, and other functions at the Sheriff's Office. And I come to you today out of frustration with dealing with Sheriff Smith and also the county in regards to the injuries that our members have been sustaining. The DSA has been embarking on every effort it can to improve the working conditions of our members. And in a recent study based on several different data sources, which include the county zone, we've determined that injury costs have increased approximately 500% between 2004 and 2017. In looking in comparison between 2004 and 2011, work compensation costs increased approximately 7.5% per year. But beginning in 2012 through 2017, worker compensation costs have increased an average of 44%. The compensation cost between 2012 and 2017 between those periods was approximately 264% total. It went from $1.57 million in 2011 to $5.71 million here in 2017. In 2004, the cost per employee for workers' compensation costs was approximately $2,234. 2017, it rose to $13,118. While the national average of injuries causing missed days work decreased approximately 2.5% per year, the cost of injuries to the Sheriff's Office increased 36% per year in the same time period. In an effort to bring the Sheriff's Office into compliance with OSHA standards for gas masks, we have been ongoing since March of 2017 with still no action and no resolution from the Sheriff's Office. Lori Smith's office has not conducted a safety audit or called for a safety meeting of the committee since at least 2016. This is contrary to the written directives issued by Sheriff Smith. The Sheriff's Office lacks newer equipment and modern uniforms used by neighboring law enforcement agencies. And today, even after it was approved in July 2017 by the Board of Supes for a pilot program, we still have not seen tasers or any progress thereof. And in a recent example of idiocy, a simple uniform change that we've been requesting was approved for custody, but it has since been denied for our members. What we're asking the county is to look at this report that I have for you today, and you should further analyze the trends that we're showing to identify the injuries that we're seeing and why we're seeing such a huge increase. And we're asking for the county and the sheriff to meet with the DSA to find resolutions to this issue. Today, the DSA stands 98 vacancies, approximately 18% understaffed. Thank you.
Thank you. Mr. Winslow, before you step away, do I gather you have a written set of comments that you'd like to share?
I have a written report for as many as you like, Mr.
Great. And why don't we ask the clerk to get a copy? Please be sure to share them with members of the committee and also with the staff who are here at the dais, as well as the management audit team. All right?
Thank you.
Thank you. Thank you very much. And Mr. Largent, welcome.
Good afternoon, everyone. Scott Largent. Good afternoon, Supervisor Smithian. I go to a lot of meetings, and I ask way too many questions, and I talk to too many people down here. I've been doing a lot of that as it pertains to the order that had me arrested at family court. I think it's very important for me to understand from law enforcement's perspective, from our legal community, even feedback from judges. I was able to speak with my best friend's father. He's a retired Santa Clara County judge. He was actually our presiding judge here for some time. And it was very eye-opening to hear it from his perspective. But I was also enlightened today by talking with a gentleman out in the hallway that was also a retired judge and hearing what his opinion was on this stuff. We did not agree. People can agree to disagree. But it was very informative. At our new courthouse there is security measures in place to protect the judges there. They don't have to go out front doors, side doors. They go out the actual snake chambers on the bottom. There's bomb-resistant panels along the sides of the court building there. There's even a bomb blast blanket that will be deployed in the lobby area if anybody decided to use a flamethrower or throw a Molotov cocktail, whatever. That building is secure. It's the newest one in the state of California. I believe it's the newest one in the United States. So judges are very protected there. So when I'm little old me out on the corner with a kid's toy, a megaphone, not in their walkways, I'm basically on a city sidewalk there, and I'm not disturbing the peace, and I'm just protesting to be able to have my daughter's visitation enforced. I'm having problems with the courts, and that's what I feel is the right way to do it. A lot of the other ladies have been doing the same thing. But with Judge Lucas's order, it's kicking everybody down the curb. It's basically sending them over to St. James Park. I do really think this is unconstitutional. I think there are things that could go through here and change, but it's kind of a give and take thing, because I do believe half of this stuff does need to be in there to protect the officers and to protect the judges. But we also need to think about the public too, because we're kind of all in this together, and we want to come to a happy medium on it. So that's what I'm just trying to do. I want to understand it better. And I don't mean to, well, I do throw people under the bus. I'm wondering what happened 9 months ago when I brought this in. And Joe, you did have James review the document, replicate the document. James is your attorney over there. Did James do his job? Did James research this document? Did James make your life easier to not have me coming in here ragging on you about this order? And that's what I really want to know. Is he doing what he's supposed to be doing over there, or is he protecting the legal community, protecting judges making up the law? I'm really wondering what's going on there. And this order did not go through the traditional process. A copy was not sent to our DA. It was not sent to our public defender. The original copy was not sent to James Williams. And it was not basically certified, stamped, and filed with our court. So they bypassed that process. And you guys should have been able to have public comment and voted on approving these rules. Thank you.
Thank you. I'm going to confirm with our clerk that that is the last of our speakers under public comment. Again, I do have a card for another speaker on item number 17. And item number 17 is the work plans for commissions supported by the clerk of the board. And we have a card from Francis McVeigh on that item. And if we get to the point where we're thinking about putting that on consent, which is going to be my recommendation in a minute, we will certainly ask somebody to come up before we take action on the item, either on consent or otherwise. May actually afford you the opportunity to speak sooner rather than later if we have it on consent. So thank you for that. Supervisor Chavez, welcome. I shared with the group here that you were trying to be in two places at once and did a pretty good job of it, apparently. So welcome. We will return now to the call to order, and we'll ask clerk to call the roll for purposes of establishing a quorum for the conduct of public business.
Supervisor Chavez. Here. Supervisor Simidian.
Here.
We have a quorum.
All right. We have both members of the committee present. That establishes a quorum, and that means we can take action. We have taken two speakers under public comment. That takes us to item number 3, which is to approve the consent calendar and any other changes to the committee's agenda. Supervisor Chavez, there were a number of items in addition to the originally proposed consent calendar that I thought might be candidates for consent today. And the items 23, 24 are already on consent. But looking through the remaining items here's what I would like to suggest with one additional comment. And obviously, if any of these are items you'd like to keep on our agenda, we certainly can do that. Item number 4, management audit self-evaluation. I will return to that in a moment. Item number 9, the countywide info technology projects. Item number 10, fleets and facilities capital project status report. Items 12, fairgrounds master plan report. Item 13, civic center master plan report. Item 14, fleets and facilities use of real estate brokers report. Item 15, fleets and facilities master purchasing and services agreements, solar PV arrays. And item number 17, work plans for commissions supported by clerk of the board. Additionally, I wanted to indicate that we will continue item number 8, which is to receive the updated surveillance technology use policies because apparently there's a conflict and we can't, the folks from the Sheriff's Office can't be here today to respond to questions. So we're going to work with them to find a date that's mutually agreeable to bring it back. And I've agreed as well to meet with them prior to that meeting to get as many issues resolved as we possibly can. So items 4, 9, 10, 12, 13, 14, 15, 17, and then continuing item number 8. The others would be on consent if you're agreeable, and the only thing I would say on item number 4, the management audit self-evaluation, is I would just suggest to the management audit team a consideration on their part of a work in progress link on the website and a more formalized follow-up process, perhaps by producing some kind of an annual implementation status of prior recommendations, but we'll just pass those along. Now, are there any of those you'd like to keep on the regular agenda?
No, but I would like to add one other item, and that is item 7, and that's a sentencing alternatives program. And the main reason I was looking at that is that the staff came up with a very good framework, and I think it will allow us to take a deeper look at this in February of 2019 after they've done.
Great, and I have read the report myself carefully, and I have no further need to follow up. So if we can get a motion from Supervisor Chavez to approve the consent calendar with the addition now of items 4, 7, 9, 10, 12, 13, 14, 15, and 17, with item 8 continued, and with my comments in the record on item number 4. If we got such a motion, I would.
So moved.
And we do. We have a motion by Chavez and a second by Simidian. And before I call a final on that, I want to call up the speaker because that might affect what we do with item number 17. So, Francis McVeigh, welcome. And we're going to change that now to 2 minutes, so I don't want to mislead you there, Mr. McVeigh.
Good afternoon. I'm Fran McVeigh. I'm the current chairperson of your Veterans Commission, and I wanted to come by and be available for questions, if any, on the accomplishment report and work plan. I think the committee will agree that we've made some significant improvements to the commission and quite a few accomplishments during the last period, and look forward to continuing to do that. Some of the high points are that we changed the name of the commission to make it more recognizable and easier to find. We especially are emphasizing partnering with other quality veterans organizations, particularly the United Veterans Council. The council is the one that puts on the Veterans Day Parade and the Memorial Day event at Oak Hill, and we thank you very much for letting us have the big banner out here in the hallway. We certainly hope that everyone here and your friends will come out on Memorial Day and again on Veterans Day, perhaps right in the parade. And the Commission and the Veterans Council will continue to work together very closely, and also with service providers from our own Veterans Service Office or any private sector or nonprofit providers. So with that, thank you very much.
We'll say thank you to you as well, and to you and your colleagues for the work on the commission. This is work that is often invisible, but important and much appreciated. Thank you.
Thank you.
All right, motion by Chavez, second by Simidian. Let me just make sure there's no member of the staff who is anxious to present for reasons.
They're all trying to avert your gaze.
Yes, they are. All right. Then without objection, the consent calendar as revised is hereby approved. Thank you all very much. That leaves us with the following items, Supervisor. Items number 5, 6, 11, 18, and 19. And I think that covers it, unless I'm missing anything. So we have those 5 items today. I do know in terms of the personnel we need for any closed session discussion with respect to election security, we have a hard stop of 4:30, but I'm hoping that given the number of items that went on, consent is not an issue. All right, item number 5, management audit, fiscal year 19 work plan. Ms. Zoll, if you want to walk us through this, I gather you're anxious to have us give you some direction today. Or
Yes.
send some direction along to the board.
Yes, thank you. The proposed work plan for 1819 includes 17,000 hours in keeping with the current work plan. And that would provide the board with 9,000 hours of discretionary audit work that we would like to have some direction from you as to what proposed audits you would like. In response to your questions from the last meeting, I went back and looked at some of the areas that we have never audited, and I noticed that there were 4 items on that list that where the revenues do not match the expenditures, and so they're spending fund balance. And 3 of those were on the medium risk list, and 1 of those was on the low risk list. The 3 that were on the medium risk list included the 2 fire districts that we have not audited, which is South County and Los Altos, and also the library. And then in the low risk category, it includes the vector control. So I don't know if that might be something that you want to look at, given the financial issues there.
Supervisor Chavez, thank you. Anything else, Ms. Sullivan?
No, in terms of if you wanted to provide us some direction today, we can come back and scope out those and let you know if there's any balance of hours that would be left over that you could then allocate later. But it would be very helpful to us to be able to know what our work plan kind of looks like for the following year so that we could do planning for that.
Supervisor Chavez, I don't want to cut off debate or discussion, but in the interest of moving us along, I just want to make sure that I recall from our prior meeting, I think you had identified the Facilities Department, Behavioral Health, and VMC Inpatient and Medical Services as areas of interest, and they were in fact numbers 2, 3, 4 on the high-risk list. So I thought that was certainly a recommendation that I could support going forward to our full board. I appreciate the report back from Ms. Solov on those that have never been audited. I'm inclined to say let's forward the 2 fire districts. The library I feel a little more comfortable with just because Supervisor Wasserman and I sit on that board and we are part of the budget negotiations and have some understanding of what the cash management decisions are and what they're based on. But on these other 2 bodies that are in the medium risk category, I think you make a compelling case that those are appropriate. And then the other one I would add is procurement, which it was last audited in 1995 and is in the high risk category. And I'm mindful of the fact that there's some new director there at the department, and I often think it's helpful when someone is new to give them a little something to work with in terms of, not only their fresh set of eyes, but the ability to have some perspective granted by an audit from an outside as well. And bluntly, and I'm not speaking about procurement, I'm just speaking generally, I think sometimes if people are new on the scene and need to make change, it's helpful to have somebody besides them point out the need to make change if change needs to be made. So Supervisor Chavez, if as I say, I don't want to cut this off, but I thought I remembered, and apparently I did, the 3 items that you had mentioned. I would say let's send those 3 with procurement with the 2 fire districts to our full board, rather than have it come back to this committee yet again, with the further request from Ms. Soloff to calculate where that puts us in terms of unused hours, if any. Not necessarily thinking we'll need to come up with something on the spot at a full board meeting, but at least we'll know then what our remaining capacity is. Can we get a motion to that effect, or a variation thereof, maybe?
I'll make that motion, and I just want to add one category, but I'm open to your consideration of this even prior to it coming to the board. And that is that, we every budget session, we have a big discussion about ESA and unfunded positions they're unfunded and vacant, and all that whole discussion. And it appears to me that it might be better to start it earlier rather than later in terms of being able to answer those questions for the board, because you'll get asked those questions in about a week or 2 when we have the budget workshops. And in particular, what I was interested in taking a look at is vacant funded positions with the timeline, just exactly what the board asked for last year, and then adding funded vacant positions where there is no recruitment occurring. I just have one other piece to that. I'm also interested, although this, again, this isn't something I'm wedded to in the near term, but I was listening very carefully to a couple of comments that Dr. Smith raised about the general fund, and I was curious about what of the ESA's budget is attached to other funds other than the general fund. So for example, if they're doing recruitment for X activity, is that activity attached to the to whatever the budget mechanism is for it? And I don't know, meaning, is ESA all general fund funded, or do we ever assign ESA funding to something other than the general fund? And if so, under what terms and conditions do we do that? So for example, for recruiting, for a while ago, we hired a high number of eligibility workers when we were very first working on filling for the Affordable Care Act, trying to get people signed up. That money, I think, all came, or a big chunk of that money came from the state, and was the recruitment part of what we built into to that?
Supervisor Chavez, I see Dr. Smith leaning in. So Dr. Smith, you want to?
We could answer that now if you'd like.
Oh, I was just going to suggest to be part of the budget process, because
It will be
Oh, yeah,
part of the
fine.
budget process, but also the costs for ESA are allocated out based on a formula having to do with how much work they do. So depending on where the funding comes from the particular department, that's what funds the service. Same thing with fleets and facilities, ISD.
So but meaning that the department they're doing the work for, they're
Pays for it.
Thank you.
And we will have, well, there's already in the budget data about vacant positions, but we'll have a final when we come back in June with all the funded, unfilled positions as you requested.
Okay.
And also, just to clarify, I also was interested in funded positions that the board approved that we are not recruiting for, right?
Yes, we'll
Yeah.
have that too.
Thank you.
Ms. Soloff, clarification?
I just want to clarify, are you talking about for this year's work plan or for next year's work plan or for both?
Both.
Okay.
Ms. Sullivan, does that give you what you need if that's a motion from Supervisor Chavez?
Yes.
All right. And I'm prepared to second that item. We do, however, have a public speaker, and that's Mr. Largent, who would like to speak on this item. Mr. Largent, welcome again.
Hi, great. Good afternoon, everybody. Normally about, I'd say 95% of the time I follow up with people. I kind of keep the communication going. I do want to apologize, Cheryl. I should have followed up. I know several different times we had brief conversations. I do want to work with the Management and Audit Division on the stuff I had talked about. It's, you kind of get that fear. You worry, you know, they're going to show up at my door, and they have. So I think I'm more open and out there about what's going on, and I'd like to get that process going. Because I know an audit takes time, and it's farther down the line. But maybe a lot of the stuff that's happening to me and happening to a lot of my other friends involving the Department of Corrections and the Sheriff would be beneficial to your audit. And so I would really like to reestablish that relationship and actually follow up with you. So I do apologize for that. So thank you. You do good work. Thank you, Cheryl.
Thank you very much for your comments. Again, we have a motion by Supervisor Chavez and a second by Simitian. For the record, are there any additional comments or questions? If not, then without objection and hearing none, motion is approved unanimously. Thank you once again. That takes us to item number 6, which is the report on SB 1193 implementation. I see some members of the staff moving down to present. Dr. Smith, do we look to the folks at the table?
It's County Council.
Mr. Williams, do we look to the folks at the table? Folks at the table, would you please introduce yourselves for the record?
Good afternoon. I'm Michael Rossi. I'll be presenting on behalf of the County Council's office.
And Mr. Rossi, we want to hear every word, so if you can figure out how to make that microphone work, that would be great. There you go.
And good afternoon, Paula Stanislaw, Deputy District Attorney.
Thank you very much. So we have both County Council and the District Attorney's Office represented. I'm not going to make any observations about, you know, who obviously has the AV skills here in the group, but we'll just let that go. We'll just let that go. Who's going to present first?
We'll be presenting together, Supervisor.
Please do.
SB 1193 is a state law codified in Civil Code Section 52.6, and this law requires that certain businesses and other establishments post a poster containing information on resources for victims of human trafficking, hotline numbers to assist victims to seek support or report, their victimization to law enforcement. This law became effective on January 1st, 2013. With respect to past efforts to implement this law, the District Attorney's Office partnered with the South Bay Coalition to End Human Trafficking in 2014 to participate in a community day of action. DA Jeff Rosen wrote a letter informing businesses of the nature of the law and the consequences for noncompliance. This letter was accompanied by a poster which community members went out to various businesses in our county and handed out the poster accompanied by the letter. The Human Trafficking Commission has had a positive impact on SB 1193. VTA reports full compliance, as does VMC. And currently VTA is seeking a partnership, and we are working on funding to create SB 1193 posters for bus shelters across the county.
To specifically address massage business abatement, as you know, with respect to massage businesses, the state returned control of licensing and enforcement to the county in 2015, and as a result of that, we modified and improved the massage business ordinance that's widely considered to be a benchmark throughout the state. Also recently, the Polaris Project has described the county itself as a leader in that regard. As you're aware, massage businesses have a high probability of harboring human trafficking activity, and under the ordinance code that I just mentioned, the county licenses massage businesses annually, so we make it a priority for businesses to comply with SB 1193 requirements. As part of our annual inspection, staff verifies the presence of the poster and the posting of that information is required for the grant or renewal of a license. In addition, as part of our abatement actions, if a business is non-compliant, we cite that violation in support of our permit revocation if necessary. Recently, we have, as of February of this year, we have inspected 3 new massage businesses that were not included in our initial enforcement action. All 3 were not in compliance, and because of that violation and several other violations, those businesses were closed. Their licenses were not renewed, and they are no longer operational. I'd like to turn now to what other counties are doing regarding SB 1193. As we discussed in our report, neighboring counties have slowly implemented efforts to assure SB 1193 compliance. Alameda County primarily relies on a mobile app called MAP 1193 and volunteers from community-based organizations to determine compliance and distribute posters. In cases of non-compliance, their district attorney's office issues letters to non-complying parties, but they have not yet initiated enforcement or issued fines. City and County of San Francisco, much like the County of Santa Clara proposes to do, is use health inspections of massage establishments and bars to confirm compliance, but has not yet devoted substantial resources to enforcement. And Monterey County has recently increased its compliance efforts by distributing posters and using Alameda County's MAP 1193 app. Regarding what other county departments are doing or are willing to do, in addition to massage businesses, there are 3 areas in which county staff may primarily ensure compliance, which are food facility inspections, farm labor contractors, and emergency rooms and urgent care clinics within the health and hospital system. Environmental health is willing to make posters available as part of the information they give to permit applicants and generally at their office. In addition to massage businesses, our Department of Planning and Development may be able to determine compliance with SB 1193 compliance during inspections of buildings operated by farm labor contractors, and this requirement may apply to the Agricultural Commissioner as well. And health and hospital system employees have and will continue to assure compliance within county-owned and operated emergency rooms and urgent care clinics.
With respect to next steps, we suggest a 2-pronged approach. First is to encourage voluntary compliance, and we think the most direct and immediate way we can accomplish that is by identifying county agencies that might have most likely interaction with the individuals or businesses covered by SB 1193. Obtain agreements from them to make it part of their protocol to include the SB 1193 poster in materials that they give out to these establishments and individuals that come to the county to apply for health licenses, to apply for business licenses, and distribute those posters in that manner. Additionally, with respect to the second prong and enforcement, we do think that it would be positive to explore the MAP 1193 and implement that within our county. And for the most part, the community would be utilizing this app and identifying businesses that are not in compliance. That would then get reported to the Light Task Force, and we could go to these businesses directly, give them the proper notifications, and issue citations based on those reports.
Thank you very much. Supervisor Chavez, I do have a brief question or two, but let me turn to you because I believe this item is here at your request.
Thank you. So first of all, thank you. And I know on the level of all the different work we're doing, the reason this didn't end up at the top of our body of work is we were working on a lot of other things. So I recognize that there's a little bit of stretch here in that we are asking a question that's landed with the two of you that may not actually belong to either department. So just squarely in any department. So a couple of questions that I would like to ask, and one of these, Dr. Smith, is to you. There are 2 big bodies of work that are coming we're going to continue to come back forward to the board. And one of them is the establishment of the Office of Labor Standards and Compliance. And it occurs to me that in some ways, coordinating this and taking complaints and being able to get even a place for the public to call to say, hey, I'd like to see a poster here. Because how we got this was a community activist who knew about the legislation who said, I've been to a bunch of restaurants and I don't see the poster and I've seen it in other cities. That's kind of what prompted it. But I wonder if this body of work or some piece of it should be housed in the Office of Labor Compliance and Standards.
Yes, once we get a director for the office, which we're currently in the interview process for, I agree we should move it over, the responsibility for the function over there.
The second part of my question is that we are in the second body of work that's been going on right now has been an examination of what are appropriate uses of our licensure for either business licenses, which is one body of work that the county's been pursuing under Sylvia Gallegos, and then another, bless you, another has been around the whole business license, but the other has been under what terms and conditions would we withhold health licenses. So the business license in and of itself within the unincorporated area, it appears to me that this should be a standard-based component of what we offer in terms of information for any new business that's within the unincorporated area. And then as part of our business license, our health, giving our health licenses, and the other areas we do weights and measures for all kinds of things, gas stations and any number of things. It appears to me that if we set this out as an expectation for anybody that we're licensing in any way as a going forward, that really is something that then gets spread to the appropriate departments that frankly do have more interaction with the public. What are your thoughts on those 3 or 2 areas?
Correct. We'll organize that through the Office of Labor Standards, but you're right. We're still working on the business licenses, as you know.
Well, and also the application and use of the health licensure. So is that something, I think those are both under Sylvia right now too. Is that accurate? The body of policy work that's going to come to the board?
It is now. It'll be transferred over to David after the board takes action for implementation.
Okay, so just, I guess what I want to make sure of is when the policy pieces come back to us, if this body of work can be embedded into those two areas of policy, so irrespective of what department they go back to, they get addressed.
Yep.
And then one last, and this isn't work that's going on, but it's just a curiosity. The other area that it appears to me that this may have some resonance is around prevention, and really thinking about what the public health department's been doing in their work, violence prevention and the like. And I don't know if if they're an appropriate partner in this at all, but I wonder if that's something that wondering you're thinking about it, because you've been more steeped in how the health and hospital system is working on the expansion of prevention. And if not, that's perfectly acceptable to say, no, that doesn't really fit under there. But I was more thinking about it because of the violence prevention component.
Rather than saying no, let me say I'll look into it.
Okay, because it may be. All right. So then as whatever action we'll take, if we can, I'll embed into the motion that those policy pieces of work get embedded into the licensure work that's coming to us, both in business licenses, but also in terms of how we're using our health permits in the future. Thank you. And then that you'll explore talking to public health about whether or not there's an appropriate role for them.
Right.
Thank you.
Thank you, Supervisor Chavez. I had a couple of quick questions which were answered by my reading the backup materials that came, but just to be clear, so the 2018 effective date really is most relevant to hotels and motels and their inclusion now on the list of affected businesses, yes?
Yes, correct.
But we're talking about just one 8.5 by 11 poster either near the entrance or I noticed it was some other conspicuous place, yes?
Yes, that's correct.
Okay, so if I walk into a hotel that's got 300 rooms and a large lobby, the question then is, where would such a thing be that it is both seen by the employees and the public? And the answer is wherever somebody thinks it meets the statutory definition of close to the entrance and or another conspicuous place.
Correct. The law doesn't go into detail and doesn't give a clear protocol as to how to ensure compliance.
Okay. And I appreciated the information. Actually, it wasn't clear to me whose background memo I was reading at packet page 41. It says attachment report to Human Trafficking Commission regarding SB 1193. And it then is numbered 1 through 8, I think. But it specifically mentioned how the list of potential businesses was identified in the materials that we had. Do we have some rough idea, and I'm looking at the DA's letter, how many folks we're communicating with or talking about here? And I'm not looking for a precise number, I'm just looking for an order of magnitude, because I couldn't tell you. I'm guessing it's more than 20. I'm guessing it's more than 200. I don't know if it's more than 2,000. Is there a ballpark number?
I don't, Supervisor. I don't have that number. I don't know if you have.
Could I just ask you to get that to us in an off-agenda report? And again, I'm not asking to make work for anybody. I don't want somebody to feel like they have to go back and start counting pieces of paper. But just a rough order of magnitude would give me some sense of this. And it takes me to my final question, which is, and I know this is a simple question, and I'm sure it has a simple answer, I just don't know it, which is, so are we doing all this enforcement work in the cities as well as the unincorporated part of the county?
I think the focus thus far has been on the unincorporated parts of the county, and the next steps that we identified in preparing this memo was to reach out to the city of San Jose and the other jurisdictions within our county to find out what they're doing with respect to implementation.
Yeah, I think, and I don't mean this critically at all, I just mean it sort of realistically and matter-of-factly, I would be surprised if there was much bandwidth on the part of the smaller cities in particular to do this work. And as I say, I'm not saying that critically, I'm just saying it sort of matter-of-factly and realistically. I'm always mindful of these issues because I represent 8 different cities, only one of which is the city of San Jose, and there I have a relatively small part of that city. So I've got 7 of the other 14 small cities, either in whole or in part, in my jurisdiction. I do think I understand the priority. I do think if we're going to be serious about this, we need to find a way to assist other jurisdictions because that's, if my recollection is correct, and I'll look to the staff, I think that's where 95% of our population are. So I'll just ask you to sort of be thinking about that and keep us informed about those efforts as well.
And let me just add,
Please.
I think you raised such a good point, and part of the reason I wanted us to sort of, for lack of a better word, sort of get our ducks in order is I thought it might be a way for us to share, here's what we're learning too, number one. But, I hadn't, just to make a point that I think Supervisor Simitian, and you prompted my thinking, is that there are a number of pieces of information right now that we need to get out to businesses and we're the newest at having a business license. So ironically, the one department that we have, or two, that the folks who do the weights and measures and the folks who do the health screenings are really the two that have the most experience internally with how we have these conversations. So I think engaging them as quickly as possible. And then it does sound like cities like the city of San Jose or any city really that has a really robust relationship with their businesses could be really helpful in helping us think about it. I'd been thinking about the other way around, but I forgot we just had business. We're babies in the business license business, so our communication with businesses has been, nothing. So thank you for that.
All right, Supervisor Chavez, the item is on our agenda today to simply receive the report from County Council and the District Attorney's Office. relating to proposed recommendations. Would you like to make a motion to do that and incorporate in your prior direction to staff?
Yes, I'll do that, and also just to include, Supervisor, your points about working with the smaller cities as well. And then, if I could, what I'd like to ask is for a report back here after, I don't know, maybe, what would be an appropriate time frame? What would be an appropriate time frame to do this homework and work with the staffs to get information?
3 months, Supervisor?
So that, okay. But, and then I'll leave it up to the chair when he's able to schedule it back for a discussion.
Why don't we say sometime this fall, September or October? How's that?
Thank you.
Okay, thank you. All right, we have a motion by Chavez and a second by Simidian. We do not have any cards on this. I'm going to confirm that with the clerk, who indicates that we do not. If they're in the absence of any objection and hearing none, the motion is unanimously approved, and we'll say thank you to both the District Attorney's Office and the County Counsel's Office.
Thank you.
All right. Supervisor Chavez, that should take us then to item number 7, but that was on consent. Item number 8, but that's been continued. Item number 9 and 10 were both on consent. That takes us to item number 11, which is the 10-year capital improvement plan. And
Mr. Atturi is going to give you a presentation about that.
all right. He gets all the fun stuff.
Members of the committee.
Got numbers in it.
Yeah.
I'm Greg Uturia, County Budget Director, and I'll like to provide an overview of the capital improvement program, and then certainly myself and others will be available to address questions of the committee. Each May, the administration presents an updated capital improvement program to this committee and then the board, concurrent with the presentation of the county executive's recommended budget for the forthcoming fiscal year. The focal point has always been the recommended allocation of resources for capital projects in the new fiscal year. However, after discussion in this committee and then with the full Board of Supervisors, administration was directed to develop a more forward-looking and comprehensive capital improvement program that aligns facility needs with the county's capacity to fund, deliver, maintain, and operate facilities. And just as a reminder, in January, just a few months ago, administration reviewed the outline and approach for this effort with the board, along with its understanding that the top priorities for the upcoming 10-year horizon include the new jail facility currently under design, the adolescent inpatient psychiatric facility, the Vietnamese American Service Center, the new Julian campus tenant improvements, the Public Safety and Justice Center phase of the Civic Center Master Plan, the East Valley Clinic, including Awake South County Animal Service Center, a VMC Emergency Department, as well as improvements at VMC to the Women's and Children's Center and Burn Unit upgrade, a replacement county communications building, and new facilities to relocate departments from 70 West heading due to immediate space needs. And this, happy to report that the 10-year capital improvement program and report that's included in this document does include these projects, plus anticipates and has some degree of accommodation for other projects that will be identified in the future from service model and operation and planning efforts that are underway for the health and hospital system, as well as the Elmwood campus. The timing and the ordering of the projects considered practical factors such as urgency, understanding of these priorities, and financial limitations, as well as logistical factors such as sequencing to minimize interim costs, as well as to maximize project delivery resources. I'm available to discuss the layout of the report, the display of the information, the overall process for the development of the plan. We also have staff here from Facilities and Fleet that can answer specific questions regarding particular projects or planning efforts. And at this point, I see Dr. Smith has a comment, context as well.
One comment, more as a warning to the public and just to get it on the record. obviously, planning 10 years in advance is very uncertain. Something like for future, that far in the future, we really can't be that very accurate. So this is our take at this particular time, and we understand that the board, based on policy decisions and operations based on realities and changes in functioning, could dramatically change this plan. So although I know the board understands that, I want to make sure the public understands that nothing written in the plan is immutable.
All right, any other comments? I'm going to look to the clerk, who's going to tell me that we have no cards on this item. Supervisor Chavez, comments, questions?
So first of all, I just wanted to say thank you. I think this is a really difficult job, and it's hard for 3 reasons. One, you're never going to be 100% right, so you're just kind of putting something out there that says, here's where we think we're going. 2, you're never going to make everybody happy. And 3, you've given us a clear target to think about, and some of that's really good, and some of that's going to be more challenging, because I think for you all, sometimes ambiguity is helpful in terms of being able to be more agile. I think 2 things that I just would like you to maybe add on a little bit to, and that is the uses of this. One is prioritization, which I think is really important. I wonder if you can talk about the other opportunities that get created as a plan like this gets refined.
Yeah, the other opportunities, as we continue to refine this, is, well, it's important context for the immediate decisions that the board is faced every year in balancing the budget. And so you can take a look at what's coming down the road to be factored in. And the more information that staff is able to gather and analyze and put before the board, the more informed those board decisions are. And certainly it also helps us work with departments and partner organizations for partnerships and for our efforts to develop long-term operational plans and have a flexible capital plan that can adjust with and also help inform operational planning down the road. And then it's also context too for when new needs come up and new requests for projects come up, for us to have that kind of context as well, to go and talk about what are the trade-offs, because you can't do everything. And without this, it's difficult to have that understanding. What are the trade-offs if we try to do something new and big right now? But with this contextual information helps inform that. So I think those are at least some of the immediate benefits that come to mind by having this type of planning compared to what we haven't had in the past.
And what I'm wondering, so that's really helpful. I think, too, as it relates to one point that you touched on, which is just the asset management opportunities that get available, I think for also just to help us understand how much money and how much flexibility do we have in terms of under what terms and conditions are we buying or are we leasing. And I know that there was a really good body of work that was done by Fleets and Facilities on what we own, what we're leasing, how many square feet, how long the lease is, and the like. And I'm wondering if there is an additional document that either you have already or one that you're looking at that is a compendium to this one that helps when you're doing the scoring, that would help make determinations about what makes sense to move up on this grid. And if that's something that could be done in the works, and really what I'm trying to understand is a discussion about when it makes sense for us to continue leasing and when it absolutely doesn't, and then you say, oh, you know what, we want to move this up because these are the following leases that are going to be coming up that we need to get out of, and this is how it plays in both the space planning but also resource availability.
Yeah, I think it actually potentially it could be an appendix or another reference tool in the future along those lines. We have discussed the need to also develop some long-term maintenance plans that we look at side by side with this, and as well as long-term leasing plans. So that way you can compare these things side by side. When does it make sense? If you're entering into a lease, what should the length of that lease be? And we're able to compare it to some of these other projects that could be coming online at by a certain date, so you know not to lease beyond maybe a point. Or is also for major facility decisions of when to do that re-roofing project. Well, maybe it doesn't make sense to do a re-roofing project for a building that you're looking at potentially surplusing at a certain point or moving out of, things of that nature. So I think that's along that lines, is taking our other planning tools and having them coordinate with that and help them inform one another.
Right, and I understand this is relatively new, and I know, Jeff, you're getting some new staff that are going to be able to, or have been able to help you sort of bring this online. But I think that from an overall strategic perspective, I know that's important to you. I think it would be helpful for the board to better understand, even in terms of what's before us in terms of priorities. And then I just have one other, more of an observation, and that is there are some places that it makes sense for us to invest, and knowing what our available expenditures are for investing in construction would be important too, or purchase of buildings. And what specifically caught my attention, and actually I appreciate you all helping me walking me through this in advance. But one thing that I was thinking about last night was the hospital, and I was thinking about I was listening to actually earlier a group of people complaining that no emergency room's ever the right size for its facility ever. Like the minute you build it, it's like surpassed its capacity. And I was thinking, that's really true, that hospitals are little Winchester Mystery House in the sense that you're kind of always keep building, to respond to capacity. So what that made me curious about was the mental health facility that's being looked at, because if we build it on that property, we own the property already. So then what available funds are there to consider what else needs to happen on the hospital in addition to that facility? In particular, because the hospital's an enterprise fund, and that made me think, oh, well, does that create different opportunities for financing, or could it create different opportunities for financing than maybe something that's really more solely general fund?
I'm going to turn to the pensive-looking Dr. Smith, and then to Mr. Iteria, if he would like to be added to the queue.
Well, we're in the middle of a SMOP for the Bascom campus, which will give us a model of what we think needs to be on the campus in terms of services now and in the future. We've hired an outside consultant to help us with that. And we're moving forward on that, consistent with the board's direction to come up with a long-term plan. We expect that the product of that consultation and our input, and obviously the board's input after the consultation is done, is that we'll be able to predict what services, how much, when, where, what types of buildings on the campus and also in the clinics. We will not obviously stop services until the consultant's done, and there have also already been decisions made that the board will progress with, so those will be included in the final SMOP process. In terms of the funding issues, as you might remember, in this budget, taking the direction from the board, we've changed around the way that we're allocating the capital resources in the health and hospital system in order to take advantage of the depreciation issues. So actually the properties, which is really the improvement, will be held in the general fund capital budgets, and the enterprise fund will be paying, at least compensation fund for the ability to use
That's
it.
right.
So the property will be owned by the general fund, and enterprise fund will pay us for their usage. We can still do lease obligation bonds, and there is the possibility to use more enterprise fund if we would generate it, although we wouldn't recommend that because it's unpredictable.
Right.
So
Right.
those are the kinds of things that we're looking at, and we try to use cash as frequently as possible. So, for example, the emergency room and burn expansions are being done with cash.
Measure A.
Right.
Right. Which is important.
Right. Just to help with that concept, I can even give an illustration for, let's say, the juvenile adolescent psych facility, in order to try to maximize, if we can, any outside funding as well. Just for simple math, let's say it's a $50 million facility, and we identify a useful life of 50 years. I'm just going to do simple math here. And so that way you're actually using up $1 million a year of that facility. We'll be very careful having the accounting and the funding for that, so that way we can identify that use of that building $1 million a year and record it in a way that we can also draw down any additional Medi-Cal, any insurance billings, any of the outside parties related to the service provided in that. So we're capturing, as it's used, the building's used up, the beneficiaries of those services, the patients and the insurance carriers can pay their fair share of that to maximize how much we can bring down and minimize the amount of local funding that has to go towards that. We'll be very careful on the front end, and doing some of this forethought ahead of time helps us plan for that as well, so we can maximize.
So if I just say this back to you in simple terms, that you are building in the flexibility to get the maximum benefit from the facility by way of, by reimbursing the cost of it, being inclusive in those reimbursements in terms of how we're doing billing and all of that, but giving the flexibility of keeping that within the enterprise fund, allowing the enterprise fund to pay essentially the county back for the use of the facility, so the asset stays flexible for other uses.
Yes, absolutely.
I don't mean for the use of the service provision, but for the use of the capital.
Right, and
And
we're
asset.
being very conscious of the fact that our funding streams come with different regulations, so that we have to make sure we parse out the costs correctly. For example, FQHC is reimbursed based on costs for the entire clinic, so we want to make sure that the facility costs are included accurately. And Short Doyle, which is mental health Medi-Cal, which pays for some of the services at BAP, and also the emergency psych facility, and will also pay for some of the services at the juvenile facility. Those are paid on a modified fee-for-service kind of basis, which doesn't really include the facilities.
I do appreciate, and I'll just wrap my comments up. I really appreciate the thought that's gone into this, and I also appreciate that in a very good way, we're trying to be very assertive about making sure that we're drawing down resources appropriately from the appropriate resources, because I think the generosity, and I mean this in a good way, of the county has been too often to rely on the general fund when we know we just have to get something done, and we'll figure out the financing later. And it sounds like we're going to catch up with ourselves and start doing that first. So thank you.
Thank you, Supervisor. Some of the ground I was going to cover has been covered, so I won't cover it again. I will just say I appreciate the move from the 5-year to 10-year. That won't come as a surprise to anyone who's a regular here in these conversations. I think to perhaps use just slightly different language, I did pick up on and appreciate and agree with what I'll call the healthy tension between a longer period of time, which I think is important, but a lesser degree of certainty about what the world looks like and will look like over that longer period of time. That being said, I think having the conversation, which is a constant one, have a 10-year time frame rather than a 5-year time frame is all to the good, and I think we all get it or should get it that's going to make things a little more subject to change. It does give me reason to pause and ask. So how do those changes get made? How does I don't think every single one of them requires a board action since it's just a plan, although each year the plan will come to us as part of the budget process, yes?
The plan will come to you as part of the budget process. Effectively, if the organization or prioritization is changed, it will happen by action of the board during the year. So there will be an action at the board to either begin an RFP, fund a particular project, whatever is required as the first step, hire a consultant, those kinds of things. And we'll explain why this is necessary at this particular time. You're right that there are a lot of factors that influence the policy direction, which I'll just say for the purpose of argument, the policy direction is this is a priority, quote, for the community, but that's also affected obviously by financing, operations, technical considerations and all those things too. So we try to get in front of the board with all of those reasons and try to get action from the board to appropriately change it.
So things could come to and through our board. They could come from community advocates. They could come from board members. They could come from administration, and often will if the administration is recognizing the capital needs of the organization. They can come to and through our board as project-specific conversations, but they can also then come just with the 10-year plan, as this one has, prior to going to the budget process, yeah?
Correct. Okay. A great example, take either the VASC or the juvenile psychiatric facility. Yeah. 10 years ago, if we were doing a 10-year CIP at that point, we would have not been able to predict that those were going to be on the plan. They're added in later on. And I'm sure there's lots of things that we're not being able to predict right now, which will be added on by coming back to the board.
I'm thinking, Supervisor Chavez, part of this I think you will very much remember and part of it not. So I'm thinking in the North County context, for example, we've had very clear and specific discussions at the full board about a teacher housing proposal where some, I'll call it contingent preliminary action has been taken by the board. On the other hand, Dr. Smith has had an extended series of conversations, some of which have surfaced in Health and Hospitals, some of which have surfaced at the full board about healthcare delivery in the North County and what that looks like given some of our community partners, and if some of them go away, and some of them are in the North County Courthouse, which is a property that we actually own, even though it's a courthouse, and parking issues there. And so those kinds of things are clearly, we've been talking about some of these issues for 2 or 3 years, not in a high profile or particularly defined way, but just as sort of part of a never ending, how is this all going to work out one day? How does that then show up one day? Again, is it by the combination of bringing specific things to the board and the 10-year plan at the end of the year?
Right. Let's take the example of the courthouse. There's been discussion at the board about teacher housing. There's also been discussion about parking structure. As we've talked, I have a fantasy that maybe a county clinic could be worked into the process. We might need to actually bite the bullet and get rid of the courthouse and build a new one, although that's
Now we're going to get phone calls from some judges. There you go.
that's clearly biting the bullet because that would be really expensive. But as we formulate thoughts and ideas, when we think they're right for board discussion, we would bring them forward and ask for direction. The board would give us direction. We'd go back and formulate a more clear project and develop a project list, and then at that point, it would be put on the CIP.
Okay. Just a couple, thank you. That's helpful to me, at least in understanding how things go on and off the document. And if something went off the document, then there's an opportunity every budget cycle to say, hey, wait a minute, what about, or whatever happened to, or gee, I thought we were going to, or whatever. Okay. In the category of phrases that only I am likely to utter, I was delighted to see the deferred maintenance program spelled out on pages 8 and 9 of the report. It's an issue that I think gets too easily overlooked, underfunded, and so I've appreciated, and I just want to recognize, acknowledge that it was there. I think I mentioned previously that I am not yet sold on capitalized interest as a financing tool, and I'm looking forward to hearing more about that if and when someone decides that's a tool they'd like us to seriously consider, and I don't need to revisit that at length. I just sort of want to underscore that so it doesn't get lost as we move forward. And I think with all of that, Supervisor Chavez, the recommended action from the administration is simply that we receive the report, and if we can get a motion to that effect, we can take that action.
So moved.
And I will second, but before we call that a vote, I'm going to look to Ms. Solov, who I think has some thoughts to offer as well.
Thank you. I just wanted to add that given the work plan that you just approved, we can do some benchmarking around some of these questions with respect to funding and processes associated with development of capital plans.
And that would presumably be with, quote, leftover hours after Supervisor Chavez and I put, I think, 5, 6 things on the list, yes?
Yes.
Okay. And that would be something that, as you report back to us as per the request on how many hours are left over, you could say, if you'd like to use them on the 10-year plan, here's how many that would take, yes?
Yes.
All right. Well, then, if Supervisor Chavez wants to amend her motion to request of you that you incorporate that, I'm happy to second
Will
such
do.
a motion. All right.
And then I want to add one other component, and I do think that FGOC, I appreciate being on the committee because I appreciate getting to dive into all of this. I think that one point that Supervisor Simitian raises that I think we may want to think about is how we, as a community, take a look at these capital issues. By that, I mean a county community, how we look at capital issues and how we're able to measure them against each other. Because he's raised a really interesting point that often what we have been doing, the way we've been doing this, is to bring a project, and in some respects that makes sense in the sense that we are often presented with opportunities. People come into our offices and they say, I've got this idea, and then we come and talk to you all and say, let's take a look at this idea. But I think being able to figure out, even if it's at the board level, taking a portion of our agenda now, the way we do it with fleets and facilities. Like sometimes the housing could be within one section of the budget. Fleets and facilities will be a board packet. Fleets and facilities issues can be in another part, and contracts could be in another part. And we may really want to be thinking more about how we structure the agenda that allows the entire board to better understand these areas. Because I think for a couple of reasons. I think one, we are going to have to really think of quite a lot about how a more strategic look at our investments and getting the board to have a strong understanding of that. But I think the other point that Joe raises is, right now, I don't think we have so much competition for projects because we're still getting started. But I think, for example, with Measure A, some of these projects are going to be multifaceted, multi-leverage, and there will be real decisions to be made. I think the point that former supervisor, Dr. Smith, made about, when do we start talking about if it's ever appropriate? I don't know, although I guess you just did it, so now it is. Oh yeah, we might need to build a courthouse, or we have to invest in parking, because those are not often core to projects, but they are core to getting projects done. And so I don't have a good way of doing that. It's just something I would like us to think about. I think from being at the city, I got used to having a section where we talked about redevelopment. And so maybe that's a little about how I've been thinking about Measure A and some of these other discussions that we're having. So just something to think about. Thank you.
All right. Slightly revised motion by Supervisor Chavez, seconded by Semidian. No cards or comments on this item. Without objection, approved. Thank you very much. And that takes us to items 12, which was on consent, item 13, which was on consent, item 14, which was on consent, item 15, which was on consent. Item 16 was a placeholder for inventory items, and there were none. So that means there's nothing to take action on there. That takes us to item number 17, which was on consent, which means we are now all of a sudden at item 18, which is the Citizens Advisory Commission on Elections recommendation regarding automatic recounts. And let me ask who's going to present on this.
Good afternoon, Megan Doyle, Clerk of the Board, and with me I have the Chair of the Citizens Advisory Commission on Elections, and I'll let her introduce herself.
Thank you. Welcome.
Hello, Melissa Willette, Chair of the Citizens Advisory Commission on Elections.
And what would you like to share with us today?
Okay, thank you for having us, or me here, and us here, to present this recommendation that our commission has been working on for quite a long time to get before this committee to require or to recommend to the Board of Supervisors that counties can opt in to automatic recounts when the elections in those counties are by a close margin.
Anything else?
That's it.
Let me just, I have a quick question, if I may, just to clarify. And forgive me, because this is kind of central to the ask, as we say, which is, are you focusing on elections within our county or the statewide elections issues that are still unresolved by virtue of the action the state took?
So we're looking at a recommendation that would advocate for counties being able to issue automatic recounts similar to what Santa Clara County does itself when they approve their pilot program to go longer. So that would be the recommendation, not necessarily to change or to make changes to the state law for statewide elections.
Got it. And then is the issue specific to counties being authorized to do such recounts in the event that it will require a recount that takes them past the certification date? Did I get that part right?
Correct. So an automatic recount that would be allowed past the certification date.
Right. Ms. Boucher, can I ask you or your team to step down, because the question I have then is, having been through this once ourselves, what's the impact of people doing recounts that take us past certification deadlines? I know we've tried to provide your office with the resources necessary to make sure that if you're going to do a recount, it gets done on a timely basis. But I'm sitting here struggling. Presumably, when a result is certified, somebody says, "Gee, I lost," and somebody else says, "Great, I won." And what's the implication of saying, "Well, not yet"? Are we talking? Let me go back to Ms. Watt. Are we talking about saying that in races where there is a recount authorized, that by definition it would not be certified? Can can you do a recount after a race has been certified and have it matter? I guess is the question I'm asking. Do you understand what I'm asking, or am I totally? I'm seeing a lot of confused faces, so I'm feeling bad about that.
Go ahead.
And please introduce yourself again, just for the record.
Right. Matt Morellis, Assistant Registrar of Voters. So I think the question is, so if the results are certified and then a recount is taking place after the fact, are there provisions of law that allow us to go back and amend the certification? There are definitely in the Elections Code provisions that speak to that. That's why, for example, any voter can ask for a voter-initiated recount, and then there's a process that's envisioned in law. If the results are certified as normal, but then there's a provision in law if the outcome changes. In other words, the winner becomes a loser, or the measure goes from passing to failing, or vice versa, to go back and effectively recertify the results. So I believe, and again, probably county council would maybe confirm this, but I believe that the legislative change that the commission's recommendation envisions would add, a county-funded, county-initiated post-election, or post-election, post-certification automatic recount to one of those cases, that's specifically called out in law, where you could amend the certification.
So let me just, I'm going to restate what I think I heard, just to make sure I heard it right, and then I'm going to ask a question. So the first thing is, if someone were using what I'll call the conventional pay-for-it-yourself method of obtaining a recount in any county in California, that recount could go past the certification date, and if the results changed, then there would be an amendment to the certification to reflect that change. Did I get that right?
That is correct. I just want to add that I believe you said the recount somewhere before certification. Just know the public requested recount would begin after certification.
Thank you. But the piece that I was trying to get clarity on, and I think I've got clarity on it, is certifications can be amended if it turns out that an authorized recount produces a different result after the certification has been issued, yes?
Correct.
Okay. Then the challenge we faced, and this is a question, the challenge we faced was that we were being told by the state, if you're doing it on your own initiative, you need to get it done before the certification date. Is that your own recount? Was that the challenge we were facing when we were looking at these deadlines?
Yes, I mean the out of the various things that the scenarios that the state law envisions, that does call for a recount that's going to change the certification after the fact. A county-initiated automatic recount, such as one we're doing, isn't specifically listed as one of those things. So that, right, so that I believe that's why the decision was being made forward, for the policy that was recently approved to have those as a pre-certification recount.
And that being said, my recollection is that even though traditionally we'd had maybe 2 or 3 that would be within the band that we had previously set for a recount, that when we had a pilot, we actually had 10 that ended up being races requiring a recount under the boundaries we'd put around recounts for the pilot. Am I remembering that right?
That's correct.
And those 10 got recounted. The recount on those 10 finished after the certification dates. Am I remembering that correct?
Correct.
And lucky for everybody, well, except the people who still lost, I guess, but luckily, from a process standpoint, in all of those recounts, none of the results changed, right?
The winners remain the same?
Thank you. Thank you. That's a more precise answer. Thank you for that. The winners remain the same. No, I get the distinction. Thank you. So the winners remain the same. If one of the winners had not remained the same, and we had come up with that result after the certification, would we have been able to amend the certification? Or is there a great big maybe out there, which is what's prompting this referral in the first place?
If one of the,
I see the county council leaning in, so I'm gonna let him lean in.
Yeah, it would have raised a lot of difficult questions.
Okay.
I mean, there's basically, I mean, I think it's fair to say there's, the elections code has a pretty prescriptive set of circumstances around how you do all of these recounts and procedures, and not included in that set anywhere is there contemplated a county-initiated recount of the sort at all. And so we've figured out a way to do basically an expansion of the 1% count pre-certification that fits that statutory scheme, and that's the policy that the board has adopted. And my understanding of this proposal from the Advisory Commission on Elections is to seek a change in state law to actually allow the post-certification piece by creating that as a permitted item.
And I can't let this opportunity for a shameless plug go by unused. Presumably, state law did not anticipate that, because state law did not anticipate that there would be a county anywhere in the state of California that was so committed to ensuring the absolute accuracy of the results that they would take it upon themselves to provide for the recount without dipping into some taxpayer's pocket. So that's my shameless plug. So back to you to actually move the agenda item along. So the goal here, Ms. Willett, is to see if we can't get the state to give us explicit authority to do what we have been obliged to do once before, what we're hoping we won't ever have to do again in terms of post-certification, but which we might, depending on the volume and the resources available. Is that where we are?
That's correct.
Supervisor Chavez, thank you for your patience with me. Just nerding right in here on this one. I think it occurs to me that we are, halfway through the second year of a 2-year legislative session. The time for bill introduction has long since come and gone, but there's a new 2-year session coming right up, December the 1st. And what I would suggest is that we refer this item to our government affairs team, Ms. Christian et al., for consideration as part of the annual policies and priorities documents that they produce. Does that sound like a sensible way to proceed?
Yes.
Okay. Dr. Smith?
Yes.
Okay.
Yeah, I think your discussion was very helpful and gives you and the public some insight into why we were so nervous about this process, because we still are faced now with what do we do if what you said happens, and if it happens before we get the law changed. It's another example of where, as you're well aware, having served in Sacramento, where the law doesn't necessarily jive with common sense.
Or with developing practices.
Right.
To be a little more charitable, perhaps. So
Charitable?
A little more charitable.
Okay.
No, thank you. And I would point out, I think the combination of additional resources to the registrar, plus the fact that we have changed our threshold now in terms of when a recount will be called for, plus the fact that I have to believe that after years and years and years of having only a handful that would have met the criteria, having 10 suddenly pop up is just an anomaly. I think it is not terribly likely, but nonetheless altogether possible, which is why I think it's worth referring it to the government affairs. So if we can get a motion from Supervisor Chavez to that effect.
So moved.
I will second, and without any objection, unanimously approved.
Can I just add a comment to Melissa and the committee? Thank you for taking your job so seriously, and really for helping the committee focus on I know the committee's worked on a whole bunch of different issues in the past, but really starting to drill down on what we need to do to keep our elections free and fair and open and transparent. So thank you.
Great. Thank you all very much. Motion approved. That takes us then to item number 19. And item number 19 on our agenda is to receive a report from the Office of the County Executive, the Chief Information Security Officer, and the Registrar of Voters relating to county election and voting security and privacy. And then what I'm going to do is I'm going to ask the team to provide what report they can appropriately provide in an open and public setting, and then ask that we have a brief announcement from the County Council prior to recessing to closed session if necessary, and I gather that it will be appropriate today. So who'd like to say what? Welcome.
Hi, Justin Dietrich, Chief Information Security Officer. Just like to give a quick update. So far, the security risk assessment has been actually completed at this point, and we are right now drafting the 4 reports that we had discussed in the prior meeting of being completed: the security assessment report, penetration test, vulnerability assessment, and the threat assessment. Once we complete those drafts, we also will be able to come up with plan of actions and also mitigation actions that we can start working with the Registrar of Voters for, and further protect our Register of Voters systems.
Thank you. Ms. Boucher, anything from either you or your colleague? No? All right, well, that gives us then, unless you have questions, Supervisor Chavez, what we can do here in our open and public setting, I believe. But I gather there is some discussion that is appropriate for a closed session. I see the staff nodding. So, Mr. Williams, can you guide us from here to there?
Sure. The committee will meet in closed session to discuss item number 21 as listed on the agenda for the May 10th, 2018 FGOC meeting.
Thank you. And just for the record, following that recess, we will briefly reconvene an open session here for an open session report, at which point we would announce any reportable action, if there was any reportable action, taken in closed session. Is that the practice? All right. Then we will recess to closed session to consider item 21 consistent with the announcement by the County Council. Thank you. We are recessed. All right, ladies and gentlemen, our committee is now going to reconvene in open session for the limited purpose of providing a closed session report. And to that end, let me turn to Mr. Williams, our County Counsel.
There were no reportable actions taken at the May 10th, 2018 Finance and Government Operations Committee closed session meeting.
Thank you, Mr. Williams. That being said, that takes us to the adjournment of our meeting, and in the absence of any objection and hearing none, we stand adjourned to our next meeting of the Finance and Government Operations Committee. Thank you all very much.